Hi, my name is Jordan, and I'm a healthcare aid student who just finished my buddyship. My final practice based experience was truly an amazing learning experience. My buddyship experience was invaluable and allowed me to have a greater understanding of the healthcare system, not to mention the insight it gave me into healthcare and how healthcare practices are delivered through the role of a healthcare aide. I thoroughly enjoyed my time in the classroom at Lethbridge College and took initiative to ensure my success as a student. I found transitioning to the real world environment outside the comfort of Lethbridge College intimidating, as I no longer had the guidance from the instructors I had grown to know. My buddyship mentor, Taylor, has many years of experience and insight into the profession, which allowed them to ease me into my role as a mentee student with understanding and compassion. My mentor was able to build my confidence and guide me into new responsibilities each day, improving my skill set and critical thinking skills which will become invaluable once I officially transition into my career as a healthcare aide. My mentor allowed me to observe, follow along with guidance, ask questions, and participate in all aspects of the client's care. My mentor, through education and understanding of my individual learning needs, was able to challenge me to become a better healthcare aid student. My mentor gave me an invaluable hands on learning experience to practice the skills and knowledge I gained within the classroom and lab at Lethbridge College. Taylor let me know what the expectations were of me, offered constructive feedback, support, and was flexible in regards to my learning needs. Above all, Taylor was able to facilitate my learning through all of these things. In fact, after I had completed my course, I asked my mentor, "What made you decide to take on a buddyship student?" We shared insight about what makes a great mentor, what was most effective about what I experienced, and what impact it had or did not have on my learning. It was great to reflect on these aspects, and it demonstrated how much thought and consideration went into agreeing to take on a buddyship student.
Hi, my name is Ashley. I'm an advisor for the Healthcare Aid Practice-Based Buddyship program. Including my role, there are three main players in this student learning team: the advisor, the mentor, and the student. As a buddyship mentor, your role is to establish a one-on-one relationship with your student, which will provide them with a sense of security while they are learning. You are a role model. The way you interact professionally, think critically, and problem solve will influence and guide your student. You are a teacher. By illustrating how unfamiliar skills are done and guiding the student through the same process, you are enhancing their skills and knowledge. You are a facilitator. By leveraging your experience and expertise, you will collaborate and assist the student in their learning. With open communication, feedback, and the evaluation of the student, you will help them achieve their learning goals. You are a guide. Collectively, you and your student will develop a learning experience pathway connecting knowledge to skills. This is achieved by assessing their readiness and providing appropriate support and constructive feedback. You are an evaluator. Through fairness and sensitivity, you will provide feedback for your student verbally, but also in the form of written notes and examples. You are a guardian, providing a positive learning environment through consistent support and advocating for the student when required. Here is a checklist of your responsibilities. Orientate your student to the facility and clinical area. Serve as a role model. Share your knowledge, skills, and expertise. Make an initial competency assessment. Facilitate the learning experience through guiding, directing, teaching, and communicating. Facilitate clinical questioning, problem solving, and decision making. Facilitate the student's scheduling, adding, changing, identifying others to work with, and other learning opportunities. Gradually increase your student's responsibility for patient care. Provide timely feedback regarding all aspects of clinical practice. Keep notes and comments, including examples of how your student is meeting the course objectives. This will aid you with the midterm and final evaluation of your student's practice-based experience. Provide midterm and final performance evaluation of the practice-based experience. Notify the preceptorship advisor in the event of a crisis that involves your student's personal well-being. As a buddyship advisor, my role is to discuss how the student is doing. You can consult with me regarding any concerns about the student's clinical abilities and performance. I will also assist with the evaluation process. I will take your comments and feedback to apply grades to the evaluation tool throughout the experience and final grade. I will also be here to listen and offer support to any concerns or situations that you have encountered with the student. Your student has responsibilities as well. They are expected to maintain exemplary communication with both of us. This includes contacting you in the weeks prior to and during their practice-based experience, appraising you of their schedule, any missed hours, handing in their assignments, and adhering to the dress code and policies. They should also be receptive to your coaching, feedback, and evaluations. In some circumstances, with my approval, students can attend workshops that will count towards their practice-based experience hours. The student should be able to exercise full scope of practice at some point during their practice-based experience. Please consider that their experience with these skills will have primarily been in a lab setting at the college, so be gracious. Finally, one of your roles as a buddyship mentor is to formally evaluate your student, both at midterm and at the end of the buddyship. This will be done through verbal feedback, notes, and examples to support your documentation. However, you will not apply any of the marks. Marks will be applied by your advisor in collaboration of your feedback, which you have documented on the evaluation tool. These evaluations will be conducted between you and your student. I can attend these meetings if you wish. Of great importance is the midterm assessment, as this will inform your student where they are excelling and where they need the most improvement. This will also be where you can help them strategize their improvement plan and lay out clear expectations with the collaboration of an advisor in order to meet the course outcomes.